How to know if it's gallstone or just indigestion? So it's basically to compare between gallbladder pain versus gas pain. Hello and welcome back to the channel. I am Dr. Amit Goswami. I'm a laparoscopic and bariatric surgeon practicing in Gurgaon with over 2 decades of experience. This is our 4th video in gallstone series. If you haven't watched the earlier ones on what are the gallstones, types of gallstones and top causes of gallstones, I highly recommend checking those out as well. Today we are dealing with a common and confusing question which I have received in the previous video comments. So how do you know if your pain is due to gallstones or it's just simple indigestion? Hit that like button if you are finding this series helpful, and don't forget to subscribe and share this with friends or family who may be going through the same thing and in need of these crucial informations. So initially, a quick recap. What is the gallbladder? Let's quickly revise the anatomy. So as you know, the gallbladder is a small pear-shaped organ under your liver. What's its job? Its job is to store and release bile, which helps in digest fat. Gallstones form when substances in the bile like cholesterol clump together and harden. So indigestion versus gallstone, the basic difference is both indigestion and gallstone can cause discomfort after eating, but they are not the same thing. Indigestion or dyspepsia, as it is medically called, feels like bloating, burping or heaviness in your upper stomach. It's usually mild and gets better with antacid preparations or time. Now, the gallstone pain, it's also called biliary colic, is a bit sharper, more intense and comes in waves. It often requires medical attention. Now, let's look at how to tell them apart clearly. If you consider the timing of pain, this is one of the most important differential points. Indigestion pain usually starts right after or during eating and gradually eases, whereas gallbladder attacks typically start 30 minutes to approx 1 hour after eating, especially after taking fatty or oily foods, for example like fried snacks or rich curries. The pain usually lasts for around 30 minutes to 3 hours and sometimes even longer. If you are waking up in the middle of the night after dinner with sharp right-sided abdominal pain, this is a classic gallbladder clue. Location and nature of pain. Where the pain hits also give us clue. Indigestion causes upper central abdominal discomfort like bloating, fullness. Gallstone pain is usually felt in the right upper abdomen and it may radiate to the right shoulder or back. It can feel like pushing a knife or tight pressure. Also important is indigestion usually gets better with burping, gas or antacid preparations, but gallstone pain doesn't. So what triggers it? Let's talk about triggers. Indigestion can happen after spicy or large meals or from eating too fast. Gallstone attacks are almost always triggered by fatty, greasy or heavy meals. For example, like samosas, parathas, pizzas, creamy gravies, etc., etc. If you consistently feel worse after oily or fried food and the pain follows a pattern, it's a red flag for gallstones. When to seek help? If you are getting repeated post-meals attacks, especially in the right upper abdomen, please don't ignore it. A simple abdominal ultrasound can confirm if you have gallstones. And if left untreated, they can lead to serious complications like infection of the gallbladder, even pancreatitis or stone dislodging into common bile duct. Better to catch it early and treat it safely, often through laparoscopic surgery. Now, hopefully you know how to tell if it's just gas or sometimes more serious like gallstones. If this video helped clear your doubts, give it a thumbs up. Share it with someone who might be benefited and subscribe to the channel and more clear for medical guidance. I am Dr. Amit Goswami and I will see you in the next video where we talk about gallstone treatment options, surgery versus medications. Take care. Thank you.